Welcome, everyone. My name is Heidi White, and I am the Group Fitness and Wellness Manager at JCC Greater Boston. Special thanks to Beth Israel Deaconess Hospital Needham and Beth Israel Deaconess Medical Center for their partnership and for helping to coordinate the Wellness Speaker Series, including tonight's topic on getting your best sleep with Rena Holzer. Rena is the Senior Nurse Practitioner in the Sleep Division at Beth Israel Deaconess Medical Center in Boston, Massachusetts, an affiliate of Harvard Medical School. She is board certified as a family nurse practitioner and has been practicing for over 25 years. She is the adjunct faculty at Northeastern University School of Nursing. She has been a guest lecturer and clinical preceptor at Simmons Nursing School, Massachusetts College of Pharmacy and Health Sciences, and Boston College. Her professional interests include health promotion, the care of patients with complex medical issues, and patient education. She and her family are members of the JCC. Her daughter will be a CIT at Camp Kaleidoscope this year after being a camper there for several years. Before I turn the screen over to Rena, a few things to note about tonight's event. Rena plans to present for about 45 minutes and will save time at the end of the presentation to answer all your questions. Please type your question using the Q&A feature, not the chat feature. And since this is a webinar style meeting, we cannot see or hear you. So please use the Q&A for any questions or comments you may have. And with that said, I will turn it over to you, Rena.
Well, thank you, Heidi. Thank you all for joining us tonight. Heidi, thank you for letting me come back. It was fun last year. We'll do it again this year. And I hope you can you see my screen? Okay, perfect. So let's talk about what we all need. Well, we need good sleep, and that's probably why you're all here tonight, is so we can get some better sleep. And I find that if we have better sleep and we're more rested, we can have better adventures and more happy dances and laughter and just enjoy our lives more. So the goals of our talk tonight are for you to gain some better understanding of why healthy sleep is important, to improve your knowledge of healthy habits around sleep, and to give you an overview of some of the sleep disorders that might be impacting your sleep. Now, I do want to caution you that this is not where we're going to diagnose or treat you or the person who sleeps next to you. I can't see any of you, but I know that some of you might be nudging the guy next to you or the person next to you with lots of sharp elbows. But let's try to prevent some injuries and improve some sleep today. So the best way to get healthy sleep is to be intentional about our sleep and our health and our habits and routines. So how do we do that? Well, healthy sleep habits are these behaviors that you can do throughout the day and before you go to bed that really impact your sleep. These habits can promote sleep or be maladaptive behaviors that can contribute to sleeplessness. With just a few really small adjustments, you can make a big difference in your sleep. So sleep hygiene is the term we use for this. And that's a series of healthy sleep habits that can improve your ability to fall asleep and stay asleep. And they can improve your overall sleep health. I like to think of sleep hygiene sort of as personal hygiene for the sleep. Personal hygiene, we're all pretty good these days about bathing, putting on clean clothes, doing our hair, but we're not so good about taking care of our sleep. And I think that's really the crux of getting better sleep. So let's talk about these habits that we can use, right? So you need to keep the bedroom quiet and relaxing. Bedrooms are not places for worry, for doing work. When we sleep, we need to have a cool, quiet, and dark environment to promote sleep. Having a consistent sleep schedule is also key. I assume, because I can't see you all, that you're probably all over the age of 18, and most of us are probably far from 18. However, most adults don't think we need sleep schedules or consistency. As Heidi said, I have a teenager who just doesn't like the limits on their sleep. And, but when she was really little, put her to bed at the same time. She got up at the same time. We all really need to do that and be really good about keeping a sleep schedule every day of the week. You want to go to bed about the same time every day and get up about the same time every day. Weekdays, weekends, vacations, holidays, that consistency and schedule are so key to good quality sleep. And you really want to set a bedtime, so that you can get at least 7 hours of sleep. We'll talk about why 7 in a few minutes. But you also don't want to put yourself to bed until you're sleepy. Well, what happens if you get into the bed and you can't fall asleep? Well, that can generally make people's anxiety levels go up. So I usually say if you can't fall asleep within some number of minutes. Now, I don't want you watching the clock and going, okay, it's 20 minutes, it's time to get out of bed. No, it's when the anxiety level starts to creep up a little bit. That's when sleep's not coming. You want to get out of bed. Again, bedrooms are for sleep and for sex, but not for worry, not for concern. So if you're having a hard time falling asleep, get out of bed, go do something else in a quiet, dark, not bright area. So don't jump on your screen and start scrolling. Okay. Well, what can you do? Again, couple of hours. So this is talking about the habits, the things we do before bed. You really want to limit your bright light exposure at least 2 hours before bed. So right now you can't see, but I'm sitting in front of a very large window with the sun coming right in at my eyes, even though there's a shade. You don't want that happening a couple of hours before bed. So I like to say if you're sitting in a room that has maybe 4 lights in it and it's 2 hours before bed, you want to turn about half the lights off, dim the lights. You really don't want to sit there in the dark. Okay, get off the electronics about 30 minutes before bed as well. Other things, don't eat a real big meal and then try to go to sleep. That's going to increase your reflux, poor digestion, and that's going to prevent you from falling asleep. You want to have healthy eating habits, as we are all trying to do. Also, avoiding caffeine or other stimulants in the evening, definitely in the evening, but also in the afternoon. I generally say, as a soft rule, don't drink the caffeine after 1, 2 o'clock in the afternoon, because that can adversely affect you falling asleep later. You also want to avoid alcohol before bed, 4 hours before bed, because that's the time it takes to percolate through your system. Alcohol can mess up our sleep architecture and can make some of the sleep disorders worse. You also want to limit your fluid intake. So in my house, what we say is water in equals water out, which means if you're drinking it, it's going to have to come out later. And if you're prone to waking up in the middle of the night, having to go to the bathroom, the less you drink right before bed, we might be able to eliminate one of those bathroom breaks. And exercising routinely is so key for our mind, body, soul, spirit, waistline, and sleep. We're here through the JCC. Make sure you take advantage of that too. And if you can't get to the center, go for a walk every day. It really does help your sleep quality. So Sleeping Beauty here is supposed to be sleeping, but what is she doing? She's on her device at 2 in the morning. So again, try to stay off those devices. They are meant to suck us in and keep us there. The light from the devices is alerting. It keeps our brains going. That's the exact opposite of what we want while we're trying to sleep. Take home here is to prioritize your sleep. Make it important, because if you don't, there are consequences. Biggest question I get is, well, how much sleep do I need? So this is information from, I think it's the CDC's website. And if you look, again, anyone as an adult or over the age of 18 generally needs at least 7 hours of sleep. Now, our requirements do change as we age. You can see the difference from a newborn to someone who's over the age of 65. But again, for adults, the general rule is 7 to 9 hours of sleep. The American Academy of Sleep Medicine has done a lot of research. This is an old statement from them, but that Adults should have at least 7 hours of sleep on a routine basis to promote optimal health. That said, over a third of adults in the United States don't get the right amount of sleep. This is a graphic from the CDC. This has just been recently updated with this information from 2020. You'll see that across all of the states, anywhere from 29 to 43% of us are not getting enough sleep. So if you understand how not getting enough sleep adversely affects your health, you can do things to change that. So what's the magic with 7, right? So many studies show that if you don't get 7 hours of sleep or more, you can have negative health outcomes. So sleep has its fingers in every organ system of the body. So if we're not sleeping well, our metabolism doesn't do well, gain weight, we can't lose it. Our endocrine system doesn't work as well, more at risk for diabetes, high blood pressure, heart attacks, strokes. Our immune function gets lowered when we're not sleeping enough. Pain management is harder. There are increased risks of cancer, depression, and other health outcomes. So I'll let you read this for a second. It says, if you don't make time for your wellness, you will be forced to make time for your illness. And that's really that take-home message, is really prioritize your sleep and prioritize your health. So what happens if you don't get enough sleep? Well, you're at risk for all sorts of things, not just health, medical problems. It can impair your work performance. You can have more errors, both at home and at work. You're at higher risk for accidents, death, car accidents, mistakes at work. If you think about the chef at your favorite restaurant, if they don't get enough sleep, they have a risk of getting burnt from the fire, cutting themselves with a knife. If your accountant doesn't sleep well, there may be errors in what they're doing for you. So there are lots of health benefits. So the U.S. Department of Health and Human Services has this objective. It's called Healthy People. And every 10 years or so, they come out with a new one. This is from Healthy People 2020. And the goal is to increase the proportion of adults who get sufficient sleep. So my hope is, having come to this tonight, you have the tools in your toolbox to help this. So my question to you is, did you get enough sleep last night? And maybe starting tonight, you can. One of those adverse outcomes of not getting enough sleep is drowsy driving. So I want to talk about this for a minute. I talk about it with every person who comes into my office, whether I see them in person or virtually. And it's pretty eye-opening. So the CDC did a study that showed that every 25 adult drivers has fallen asleep while driving in the previous 30 days. That's pretty shocking. Adult drivers who don't get enough sleep, or at least 7 hours of sleep a night, and or who snore, are more likely to have this drowsy driving. And the last dot point just shows that drowsy driving is part of the reason that there are so many crashes and deaths and injuries on the roads. And from the data from 2020, that's probably underestimated numbers. We all kind of know what the signs of drowsy driving are, but we're not necessarily so good at responding to them. Yawning, blinking, missing the street that you're supposed to turn off on, or the exit, going, oh, wait, did I miss that? What was that? Are you drifting into the lane next to you? Are you winding up on those rumble strips on the side of the road? Those are all signs of drowsy driving. So I always tell everyone, even if you're a block from home and you're this much sleepy, you're really not safe to drive. There are so many maladaptive behaviors that I have heard of from my patients over the years. Turning up the radio, rolling the windows down, calling a friend, dumping ice water on their head or in their lap. I've heard a lot of it. These are all maladaptive behaviors. The safest thing is, if you're driving and sleepy, pull over, turn off the car, take a rest or a snooze, and then get back to where you were going. Even if you're delayed a little bit, it's better than never getting to your destination or someone else not getting to their destination that night. How do you prevent drowsy driving? Well, everything we've just been talking about. Improve your sleep habits. Get enough sleep. Treat those underlying sleep or other medical issues that might be out there. Careful of some of the medications that you take. They might be making you sleepy too. Clearly, don't drink alcohol while you're driving or before driving because it really impairs your reaction times and it increases your drowsiness. But not getting enough sleep also has the same effect. Drowsy driving can look just like texting and driving and drinking and driving. You can get pulled over for it. Healthy sleep requires getting enough sleep, getting good quality, timing, and not having other things going on in your sleep. So we talked about all that, but really, why is sleep so important? Well, there's a lot going on while we sleep. Historically, people thought you sort of died or didn't do much when you were sleeping, but there's actually a lot going on in the brain and throughout the body when we sleep. Memories consolidating, information's being processed, new pathways and connections are forming. The channels in the brain, the lymphatic system gets cleaned out. All the gook and junk that winds up in our systems throughout the day gets cleaned out when we sleep. But growth, metabolism, cell repair, all of these things are happening while we sleep. So now that you have that background, let's talk about probably why you came today, which is to talk about possible other things going on while you sleep. We call them sleep disorders. They are so common. The presentations of many of these sleep disorders are very varied, but they often coexist with each other. We see a lot of layering of diagnoses in sleep. So these are some of the sleep disorders that we see. And the red circle shows you that there are about 4 or 5 sleep disorders that this person is having simultaneously. We're going to go through some of these briefly. Again, what we talk about here is not meant to diagnose the person sleeping next to you or you, but it is to give you a little bit more knowledge because knowledge is power. So what do people say when they come to see me, the sleep specialist? Well, I have difficulty falling asleep. I can't stay asleep. I wake up a lot of trips to the bathroom during the night. I can't fall back to sleep. And I can't turn my brain off in order to fall asleep. And gee, why is it always easier to fall asleep on the couch in the evening, but when I get to the bed, I can't sleep? Well, my friend, the little duck here, has the same problem. And so let's dig in a little bit. Charlie Brown also has that problem. He wants his brain to stop thinking so much so he can sleep. So let's talk about the insomnia poor Charlie Brown is having. It's the most common complaint people come in. I can't fall asleep. I can't stay asleep. But insomnia is a manifestation of behavioral, psychological, or biological dysfunction. What does that mean, right? I'm falling asleep. I can't stay asleep. I have enough opportunity to sleep. I'm just not making all that sleep. But insomnia doesn't just happen at night. This is a state of hyperarousability. A lot of us saw that early on in the pandemic where we were just kind of vibrating all day, doom scrolling, just not able to sleep. But because of all the changes in our world, but this can happen anytime, even when there's not a major pandemic. So I think this gentleman is really having a lot to say here. He was too anxious to sleep, too sleepy to work, and too lazy to go to the kitchen. I think this happens a lot with a lot of us. But if we look at the picture, the lights are on in the room. He's got the laptop open. His sleep hygiene needs improving. So insomnia, as I said, is super common. Over 35% of adults have some kind of insomnia, according to the American Academy of Sleep Medicine. It's more common in women, older adults, people with stress, certain medical conditions, including some mental health issues. The definition of insomnia, it's a sleep disturbance that has daytime symptoms. And as we talked about before, when you don't get enough sleep, it can mess up your daytime functioning, as it's all listed here. So what causes insomnia? Well, I'm sure most of you can actually tell me that, right? Stress, other stuff going on in your sleep, medical conditions, menopause, pain, mobility issues, as well as pregnancy, mood disorders, depression, anxiety, substances, be it medications, prescribed or not. Over-the-counter medications can have these side effects as well. Excuse me, other substances, alcohol, caffeine, other stimulants. And if you're coming off of some medications, noise, light, temperature, as we talked about before, which is why you need your bedroom cool, quiet, and dark. And then lifestyle habits, work, timing of your work, things like that. How do we treat this? Well, good question. In our office, we do a deep dive into your sleep and we really try to understand what's going on. Insomnia, probably 90% of the time in my office, is not what we call primary insomnia. It's caused by something else, an underlying comorbid condition, some other sleep problem, other mood issue, pain, circadian issues. We'll talk about some of those in a moment. So those need to be addressed before the sleep can improve. Sleep hygiene, we already talked about. You can also treat it with something called cognitive behavioral therapy for insomnia. And this is similar to regular CBT, but it is targeted really in the insomnia, talking about more about the behaviors that are around your sleep, managing the stress reduction, relaxation, and the sleep schedule. There are medications that you can take as well. Notice the order I put these things in. Medication should not be the first line of defense here. Looking for the underlying comorbid condition is really where you really should be looking. For chronic insomnia, things that are going on 3, 10 plus months, you really want to be careful about what medications you're taking. Every medication has side effects. Or you can just count sheep, which is not a good thing. Let's talk about some of these other disorders. So breathing, right? We think of obstructive sleep apnea. There are other kinds of breathing issues. So in this little cartoon, do you mind sleeping in the spare room? Your snoring is keeping the dog awake. This is, I hear a lot in my office. So obstructive sleep apnea is the most common form of sleep apnea. It's caused by, well, an obstruction in the upper airway. Excuse me. Most people don't realize that this is an actually serious medical condition. It's not just cute snoring that keeps your partner awake. This can adversely affect your cardiovascular health, your psychological and neurological stuff is also going on here. It affects a lot of people. Yes, that is 1 billion with a B worldwide. So let me give you a quick anatomy lesson. So our airway starts at our nose and goes all the way down to the bottom of our lungs. In these pictures here, we're talking about the upper airway. And so that's coming from here to here. When we're awake, our airway stays up and open. But when we sleep, everyone on the planet has some degree of collapse to that upper airway, which you can see in that second graphic where the person is lying down. Everyone on the planet, as I said, has some collapse. But the problem is when the pathology or the problem comes in is where that airway is collapsing more times than it should. And you're not getting oxygen to your brain and you're not getting oxygen to your heart. So that puts strain on the brain and the heart. It can sort of, if you think back to when you had a little kid who could get out of bed and came and poked you while you were sleeping, that's that frequent arousal from sleep. Your breathing is stopping and waking you up, and you can wind up with this partial sleep deprivation. Sleep apnea is super common. Lots of people, millions of people in the US have significant disease. It's a little bit more common in men than in women, but we still think that over 80% of the population has not been diagnosed. What puts you at higher risk for having this? Well, if you're male, if you're over 40, if you're overweight, you have a family history of snoring, if you're a postmenopausal woman, also if you're taking testosterone supplements, or if you have any facial structure issues. We all sort of already know what the symptoms are: snoring, gasping, choking, pausing when you're sleeping, sleepiness in the daytime, as we talked about, insomnia, needing to get up frequently during the night, dry mouth or throat, morning headaches, frequent sleep disruption, concentration, focus, memory, mood issues, decreased libido. Now, in women, the symptoms are a little different. They're a little bit more nonspecific. It's sort of like heart disease in women. Heart attacks present a little differently in women than they do in men. And that's the same here. So fatigue, depression, anxiety, insomnia, those are sort of what we call the softer symptoms. You don't necessarily see women coming in with complaints of bad snoring. How do we diagnose this? Well, we talk to you, we ask you lots and lots of questions, get to the root cause, and then do a study, a sleep study. There are lots of different ways that we can do that. And if you need that, the person that you're talking to, your provider, should be able to choose the one that will give you and them the most information. So you get diagnosed with sleep apnea. We know that means you're not breathing when you sleep, and that puts you at higher risk for all of these things. How do we treat it? There's lots of different ways. Now, I always remind people, sleep apnea is not a weight-based disease, okay? A lot of people think it is, but it's not. I have seen newborn, early on childhood with it. I have seen small people, larger people. It doesn't really matter. It has to do with all of those other factors. If you lose some weight and lose a little weight from your neck or around your belly, could it help decrease? Yes. Is that the only treatment? Probably not. So like the disease processes that we see that get layered, I like to layer our treatment plans as well. So weight loss, body position, and some of these other things as well. Again, avoiding alcohol, benzodiazepines, opiates, they all can relax the airway and suppress the respiratory drive. So we all know, we've all heard, or you have someone that you know who uses a PAP, positive airway pressure machine. So what is that? It's a box with a tube to some kind of mask interface. The box takes room air and pressurizes it. It blows it into the upper airway to hold it open so it doesn't keep collapsing. And that's a very good thing. And that way you keep getting oxygen to your heart and your brain. Generally very well tolerated once you get used to it. It's 100% effective when it's used and 0% effective when it sits in the closet. Mandibular advancement device or an oral appliance. These can be made by a sleep apnea dentist. They are custom made. There are hundreds of different kinds out there, just a smattering of pictures here. And it's an upper and lower plate, usually held together with bars or wires or rubber bands, that basically pulls the lower jaw forward to essentially open up the back of the airway so it doesn't collapse. We've all seen the ads on TV for Inspire. And what is that? It's a surgically implanted device into the chest wall. And then they run a wire along the hypoglossal nerve, which is the nerve that innervates the base of the tongue. And that you turn it on when you go to bed, and you have to turn it off again when you wake up in the morning. And that helps kind of little zap to the base of the tongue to move it out of the way during the night. We in sleep medicine think it's effective, but it should not be used necessarily for first-line treatment. That's where I'll hold on that. Let's talk about timing, circadian rhythm disorders. There's lots of them out there. But this is really, circadian is clock time. And it's based on whether we call it advance or delay, is really based on where you live and your timing of sleep in relation to the social norms. So here in Boston, most people go to bed between 10 and midnight and wake up 6 to 8. So if you're going to bed earlier than that and waking up earlier, we call you phase advanced. And that happens normally. Some people are hardwired that way, but our body clock can advance with age as well. In contrast, we have the phase delay, which are the night owls. So again, we go back to our sleep hygiene because our behaviors can influence our timing. Being on our screens, getting light at the wrong time can push or delay our sleep times. Now, again, as Heidi said, I have a teenager. Phase delay is very common in adolescents and teens because of hormonal changes too. And then you have shift work disorders if you're like a nurse or someone else who does rotating shifts that can mess with your clock timing. This graphic just shows where normal is and where advanced and delayed are, and shows that we can move your sleep timing with some therapies, either light or medication or both, if we need to get you back to normal or where the social norm for the timing is. What influences our circadian timing? Well, meals, when you eat, how much you eat, your sleep habits, the light exposure, and the timing of your physical activity. Now, I get this question a lot of when should I exercise? My answer is whenever it works for you, where it doesn't adversely affect your sleep. I have some patients who can exercise at 10 o'clock at night, then take a shower and hop into bed and no problems falling asleep. I have others that if they don't finish their morning workout by 9 a.m., it prevents them from falling asleep later in the night. So you really have to know your own body. Movement disorders, there's lots of them. A lot of people like to talk about restless legs, so we'll talk a little bit about that. So this dog is saying to the other one, if it only happens when you rub your tummy, it's not restless legs. So restless legs is a clinical diagnosis. We'll ask you lots of questions to understand what you're feeling, what the timing is, because there's a circadian pattern to this disease. But it's really, when does it happen? What are you seeing? What are you feeling? Generally, it's this uncanny urge to move. I've had some patients explain it to me like if they don't move, they're going to climb out of their skin. It has to do with dopamine dysfunction and CNS, meaning central nervous system or brain iron. And those stores can be low. How do we treat it? Well, avoid the things that make it worse. Some of the sedating antihistamines like Benadryl can make this worse. Alcohol, caffeine, again, trying to limit your caffeine and move it earlier in the day can help with these. We may test your iron stores, and if it's low, we might give you some supplementation. But massage, acupuncture are also very good. And there are medications. Medications have a place in treatment, but you want to, again, look at where the underlying issues are and deal with that. When should you seek medical advice? That's always a good thing. Well, now that you have a lot more knowledge, you can start with changing your sleep habits. And then if you're then still having these persistent sleep issues that are interfering with your regular life, that's when you want to call your primary care, and they may then refer you to sleep specialists. We're happy to see you. If it's more complicated, that would be the time to see one of us. Primary cares are fantastic and can manage most of the sort of straightforward obstructive sleep apnea. But if there's anything else that's going on, you should really call to see one of us. So in summary, excuse me, sleep disorders are super common. Poor sleep can affect everything. If you don't get enough sleep, or it's at the wrong time, or the quality is poor, it can adversely affect your sleep, put you at higher risk for chronic disease, make it harder to drive your car, put you at higher risk for injuring yourself with your car. Lots of sleep disorders out there, and they can all overlap. Again, finding what the underlying cause is and treating it is super important. And again, If you have these symptoms, there's impaired daytime function, you really want to call someone and be seen. So to remind you about these good, healthy sleep habits, that sleep hygiene, limit your caffeine at least after 2 p.m., if not earlier in the day. You want to avoid alcohol because it can mess up your sleep architecture and make underlying sleep disorders worse. Taking time to unwind, having a healthy routine that you do every day, but making sure you're unplugging and not dealing with work and the world right before you go to bed. Remember, bedrooms are for sleep and for sex. We want to leave the worry, the screams, the work, the homework, whatever it is outside of the bedroom so we can have that cool, quiet, and calm space. You want to limit the naps and avoid just hanging out in bed. Again, bedrooms are for sleep and for sex. They are not for watching TV, reading the paper, or doing your crossword puzzles or doing your emails there, right? And again, having that consistency in your bedtime and routine are so important. My big take-home message, I must say this 40 times a day. Self-care is not selfish. You really have to prioritize your sleep and yourself, because if we're not taking good care of ourselves, we can't take care of anyone else around us. These are some really good online resources. If you have any further questions, these are vetted places that have real good information. Do not just Google or ask Siri. I'll leave this up for another moment or so, but I hear that this will be on the JCC website, so you can always go back to look at this as well. This is my now teenager when she was probably about just over a year and a half old. So my hope is that you have good and healthy sleep, and that our talk tonight has really helped you understand the need to prioritize your sleep and get better quality sleep. And now Heidi will take some questions. This is the contact information for my office if you would like it.
So if you have any questions, you can type them in the Q&A. Nope. Well, Rena, I will kick us off with a question, which I kind of asked you when we were meeting beforehand. So for the person that falls asleep, has no trouble falling asleep, but gets up 2 to 3 hours and then can't fall back to sleep. And let's say they are practicing that good sleep hygiene that you were talking about. Should they just speak to their doctor and maybe get a referral to a sleep specialist? Would that be the next step?
They may not need a referral to a sleep specialist. The primary care can probably start the basic work on that because there's a lot of other questions, right? Are they snoring? Do they have any risk factors for sleep apnea? And I think the person that we were talking about kind of fits some of those check boxes that they should probably follow up with their primary care. But again, looking for what's the root cause. But yeah, that it sounds like they really should be seeing someone to talk about it.
Any other question here?
Perfect.
So can you talk more about preventing early morning awakenings and falling back to sleep?
Yes. So again, that's a great question. Thank you. Early morning awakenings can be from a myriad of reasons. It could be because you stopped breathing and your brain just woke up and then you just can't go back to sleep. So that's a thing. There's also, if you're getting light exposure too late, it can push your clock time in the wrong direction and make you wake up too early. Again, if there are any of those maladaptive behaviors that happen once you wake up, if you're not keeping it cool, quiet, dark, if you're then jumping on the internet in the middle of the night, things like that can prevent you from falling back to sleep. Again, if there's any underlying worry or other medical problems, if you continue to have those problems, definitely call your primary care or come and see us.
And can you talk about the role of hormones?
I'd like to understand your question a little bit more, but general broad strokes, people on both ends of the spectrum of hormones can have issues. Our teenagers have hormones that are raging, and our older adults have ones that might be waning. And so the hormonal balance can affect when we're going through menopause. We get those hot flashes, and that alone can wake you up and give you problems falling back to sleep.
Thank you. What time in the evening would be too late for exercise?
That's a good question, and it really depends on you. As I said, I have a couple patients who tell me I can 10 o'clock at, they go to bed at 10, 11 o'clock at night, and at 9 o'clock, they're doing their treadmill. And I have others that, if they even think about exercising after 7 o'clock, they won't go to sleep at night. So I think you really there's no hard and fast rule on that. It really depends on your biology and physiology. So you can sort of see if I exercise here and want to go to bed here, does that work for me, or do I have to figure it out?
Good. And how many hours before one wants to go to bed should she stop working on the computer?
That is a really good question. It also sort of depends. It depends what you're doing on the computer. Is it work? Is it what we call in my house for the adults homework, which means paying bills or surfing the internet? Is this something that's anxiety producing, or is it fun? Those things all really play a role. Hard and fast rule is get off their devices at least 30 minutes before bed. For most people whose devices are relatively young, phones, Android as well as iPhone, computers, laptops, they all have a night mode. And all of our devices in our house are set for night mode. So 2 hours before everyone's bedtime in my house, their devices change color and shift into this night mode. That is there not only to remind the person that when they're working that, it's sort of maybe time to pack it in for the night, but it's also to limit the light exposure and the blue light coming from the screens. I don't recommend the blue light blockers, but I do recommend doing what we call the night shift. I think that's one of the names for it, night mode, but that changes the contrast, so it allows you to work a little longer with a little less brightness.
This person's loved one has dementia and is able to fall asleep and then wakes up after a few hours and gets dressed for the day, and she's looking for some guidance.
That is, it is hard as a caretaker. That's really hard. So I feel you. I would talk to your loved one's neurologist on this as well. Dementia can play around with our circadian rhythms or clock times, like we were talking about. So you might want to talk to their neurologist about timing of light, making sure they're not sleeping during the day, because you can flip your days and your nights with that condition. So it would be a good place to start with your neurologist. You can always get a referral to the sleep folks as well.
Comment, sleep worse after menopause. Maybe you can elaborate on that a little bit.
Let me think. I'm thinking that you're asking me if your sleep is worse after menopause or how to make it better. And I would say definitely talk to your primary care. Menopause can kick off a series of things. People who were good sleepers before can then have poor sleep. And again, it's that temperature regulation, depending on where in menopause, are you perimenopausal, postmenopausal? You may want to talk to your OBGYN, your primary care. But again, what else is going on? Postmenopausal women are at higher risk for sleep apnea. Are you having any other sleep issues that are now being unearthed?
Very helpful. Any other questions? Anything else that you want to share, Rena, or
Either I have
I think you
completely
might have
stumped.
answered everyone's questions.
I was going to say, I either have
You did
completely
a really
stumped
great
you
job.
all, or you all are so knowledgeable now that you will go and have fantastic sleep. And I hope it's that. Well, if you do have any questions or concerns that come up, again, my office phone number is at the bottom. There are numbers, many of us in practice, but I would suggest talking with your primary care first. They are super knowledgeable, but work on your self-care, and that should improve your sleep.
Thank you. Thank you, Rena. And special thanks to Beth Israel Deaconess Hospital, Needham, and Beth Israel Deaconess Medical Center for sharing this important information about getting your best sleep. If you would like to hear this presentation again, or if you know someone who might benefit, we will be posting the recording on the JCC Greater Boston website at bostonjcc.org on the Wellness Speaker Series page. And if you have any questions about JCC Greater Boston's programs, you can also email me at hwhite, that stands for Heidi White, at jccgb.org. So thank you so much, everyone. Thank you, Rena.
Thank you.